Welcome back. Our first soundbite of day 2 at the annual meeting in Baltimore is with Leah Myers, Executive Director of Families SCN2A Foundation, and Jenny Burke, who's on the board. This morning, Leah spoke at the Research Readiness for Rare Diseases Symposium on the 4 pillars of research readiness. So in a nutshell, what do you see as the foundation's role in supporting the patient community, and how does drug development fit in?
That is a loaded question. You want me to hold it? Okay. We have always believed in building a very strong community from the start, and supporting a community and empowering them with education about their personal variant within the disease and what they need to know about it, and understanding how clinical trials work and what we need to do to get there has been the most critical thing we've done. And I truly believe that a strong clinical trial ready community is going to make all the difference when we get to clinical trials.
And for those of us who missed your talk this morning, what are those 4 pillars of research readiness?
The first pillar is clinical phenotyping, which is defining what the disease looks like, documenting it, and getting it into the publications, getting it into literature. The second pillar is basic research, which is understanding the molecular and biological workings of the gene to make sure that we understand how it works and what happens when it's not working. The third is translational research, which is taking all of what you've done in clinical phenotyping and basic research and translating that into a treatment for this disease. And a lot of times that is it's where we are right now, mostly, and it's one of the most important things. And then the fourth pillar is clinical trial research, and that is mostly done by biotech and industry because it's super expensive, but there's lots of ways that we can support it along the way.
And what are some of those ways that you like to be involved with drug developers, and especially on the industry side?
Well, it's very important to us to develop a lot of collaborations with industry. So we talk to them often, we push them, we try to find out what their needs are, and then get the information to them. And we talk to our community. We're very honest with our community about what's going on in drug development, because we really need them to be involved, or there won't be anyone to do the clinical trials on.
Right.
Right, and actually that was going to be one of my questions. A lot of these new therapies involve altering genetic material, and sometimes it can't be undone, right? We've all heard about the one and done. And this can be, I imagine it can be an extremely scary decision to make, especially if you're a parent and having to make that decision for your child. So what should we in the CGT field keep in mind as we're in the weeds developing this next generation of medicines?
I think preparing our community, it really relies, it falls on us, the patient advocacy groups, to prepare them to be able to have the conversations that they need to with their clinicians to really understand and weigh out the risk benefit scale to determine if this is right for them at that time. That's a very difficult conversation to have, and a lot of clinicians are not initiating that. So we're really working with our community to teach them how to initiate and how to lead these conversations with their clinicians, because you're right, there are a lot of risks. I do also firmly believe that the risks should be up to us, the families, on what we're willing to risk to see improvement. And we've done some studies on that. What does better look like, and what am I willing to risk to get that? And you'd be very surprised that families want to see very small increments. If my child could be potty trained, that would be life-changing for us. That would give him some independence and some dignity that he doesn't have now. And that would be enough for me to risk going into a gene therapy.
Wow. And so because the patient advocacy organizations like your foundation play such a critical role in educating and creating awareness among the families and caregivers, it sounds like collaboration, outreach is really imperative early on in drug development. Is that right? Yeah. So as we wrap up here, what would you like to impart with everyone attending the meeting this year? What should we be keeping in mind?
Talk to us early and often.
Transparency is key. So just be as honest and open and upfront as possible. We will weigh out the hope and the expectations.
Thank you so much. All right, we'll see you on the next episode of Soundbites later today.